welcome everyone. We're here today to talk about we're kind of deep dive UI UX talk. So if you want to sort of learn from some of the experiences we've had in kind of building patient experiences engagement for telemedicine, then you're in the right place. But let's not kind of drown you with slides. Let's kind of, what I'm going to do is I'm going to stop my share now, 2 seconds, and then you can actually see Andreas and I. So before we start, Andreas, I'd love you to introduce yourself.
Yes, of course. Thanks for having me, Adam. It's a pleasure to be here. So I work at a company called Whereby. I'm managing director for growth there. Have been with the company for about 4 years. Started in a product role. That's also sort of where my past expertise lies, mostly in product. I've worked for a couple of browser companies, one of them being Mozilla, working on Firefox, and then I joined Whereby. And so about a year and a half ago, I've transitioned more to the marketing / commercial side, and sort of have been focusing on that side. So as I like to think of it, sort of exploring the market side of product market fit. And so what Whereby is doing is we provide a video conferencing service, specifically targeting telehealth platforms. So it's an API that telehealth platforms can integrate, and that way they can bring, with a very straightforward API, they can bring a very good pre-built video conferencing UX to their platform, integrate that, and add that capability to their site, to their platform, to their project. And then we have another product that is with our SDK. You can also use our video and audio capabilities essentially, and add a custom UI on top of that, and sort of provide video conferencing capabilities with a completely custom integration, and add that to your service. So those are the 2 products we provide. And yeah, it's a pleasure to be here together with you in this webinar.
So you're absolutely deep in the weeds of kind of patient experience and
That's correct.
clinician experience from a telehealth play. Fantastic. So for those of you who don't know me, I'm Adam Bird, CEO and co-founder of Cronofy. We're a scheduling infrastructure play. So we enable software companies to embed scheduling into their applications. And I'm one of those rare CEOs that can actually code. I'm not sure how long my team are going to allow me to, whether or not I've moved into the kind of dangerous rather than useful kind of zone of influence. But I spend my time kind of immersed with product teams embedding scheduling into their workflows. And the reason we're both on this webinar is that recently Cronofy and Whereby have combined partnership, whereby you can actually start to trigger your own sort of creation of the Whereby meetings as part of the scheduling process. And you'll see a kind of theme emerging of how we think about us being the provider of the plumbing, so you can be the provider of the differentiation for your application. And I guess a good place to start is kind of why we're here. And there's a stat here: 88% of users abandon apps after a bad experience. And that's kind of, that's something that we need to be able to resolve. And also, I think what's interesting, if you probably talk a bit more to this, Andreas, but I understand that sort of 33% of telehealth consultations are actually on mobile, in which presents some different challenges, I guess.
Yeah, of course. So we've seen that a lot of people sort of they've become more comfortable with telehealth services, perhaps in the beginning of the pandemic when a lot of this was new. And I think, of course, telehealth was existing, before that, but it sort of, accelerated during the pandemic. People often thought of this as, okay, I need to be in front of my computer, in front of my laptop to take a call. But we see more and more that this has evolved, and people like to, say, for instance, talk to their therapist while they're on the go, or while they're, on their way to work, perhaps having a walk, or maybe just from the comfort of their couch. And then they prefer to have a handheld device. It's perhaps also more private, depending, of course, on your setting. And so we see that, a lot of calls, 1/3 actually, involve a mobile device. So that's something we have to keep in mind when we build telehealth experiences. You have, of course, a smaller real estate on the screen, and that comes with certain limitations and certain possibilities as well.
Sure. Yeah, and I think another stat I think we've got kind of in our catalog of stats here is 83% of consumers believe that a seamless user experience across devices is really important as well. So whilst perhaps the appointment is being conducted over a mobile device, perhaps the setting up or questionnaires or other things are done on a desktop. So yeah, so hopefully you'll end this this webinar with some actionable advice you can bring to your own applications. And there's some specifics in telehealth really, probably kind of most around sort of trust and privacy. Love to kind of dig in a bit more there on kind of what are the kind of things that we need to think about specifically with telehealth over other applications when it comes to trust.
Yeah, sure. So I think from a trust perspective, so what we've seen is that it's important for users um, that they feel like they're in a private room, basically, with their therapist, right? Often they're, for instance, if they're in a therapy session, they're sharing confidential information. And so there, for instance, one thing we've seen that works well for us, or that users understand, is rather than just giving them a link where they click and immediately they're in the room, we sort of offer them a pre-call experience where they say, okay, am I getting ready? They can check, what they look like, if their microphone works well, etc. And then they knock, and sort of the knock shows like, okay, this is a closed environment that I'm entering. Once they enter, they're there with their therapist. And they're a bit in a secluded space, mimicking a real world setting. And that is, for instance, something that creates additional trust. And then, of course, if you do things like, say, for instance, we have a feature that allows you to do transcriptions, or also a feature that allows you to do recording. Of course, there might be different situations where you would want to enable this, but in any case, we always make it very clear in our UI what is happening, not that it's just happening somewhere hidden in the background, but we really make it clear in the UI, okay, this session is being recorded or this session is being transcribed, of course, only after the therapist has enabled this. And sort of these things help to create trust. Another small thing that is important to highlight is we give users absolute control over their camera and microphone, whether it's turned on or off. So the only place where you can do it is from the buttons in the UI. So it's not like you can do something else or somebody else would remotely be able to control this, right? This is very important from an end user perspective, that you give them that trust and that they keep full control over, which audio and video they're sending. So,
Fascinating. Okay, so sneak peek of some of the things we're going to be talking about later on. I guess, should we take a step back, because the current reality, should we say, it feels like COVID happened and now we're dealing with the kind of the aftermath, if you like, of this blunderbuss through our lives, and especially when it comes to telehealth applications. So lots of demand for it, but what do you think the legacy of that kind of rush to kind of move what were personal experiences to online experiences?
I think perhaps it definitely accelerated things, right? It's quite obvious. I think there was already sort of a slow trend towards having a remote session, therapy session, perhaps with your doctor, with your therapist. But definitely COVID accelerated this, and it becomes much more, an option essentially. Shall we do this virtually or in person? So that definitely has happened, or was something that is sort of something that's here to stay. I think in general also some of the early on, a number of decisions were made that drove people to quick solutions, stopgap measures, essentially, to kind of deal with a quickly evolving situation. And then now I think people are taking a step back and saying, okay, is this fit for purpose? And sort of we see, heightened user expectations as well. And you have to keep that in mind, essentially, when you're building a platform or when you're building a product.
Right. Okay. So we're in that phase now where we've kind of proven the need for it, but now we need to do a kind of proper job.
Exactly. There's sort of it's sort of a bit it follows a bit the typical hype cycle, right? Where everybody just jumps on it, and then
Yeah.
there's a bit of disillusionment, and then
Yeah.
now it's sort of the slow, steady path we're on, where it's a mainstay. It's here to stay. A
Mm.
lot of things that were optional in the beginning are now table stake features,
Yeah.
table stakes features, and yeah, it's a matter of platforms to keep up with those and to provide. Yeah.
Yeah, I guess there's an element of in the kind of rush, there was lots of people doing things for the first time.
Yeah.
And so there were no kind of emergent best practices. People were just trying things out. And I guess where we are a few years on is there have emerged some standards, and back to that trust piece, there are kind
Exactly.
of ways of building trust and providing the UI. And yeah, hopefully we're here to share some of this. But we talk about there's a bright future for this.
Yeah.
Technology
Indeed.
can be used for good. What should we be thinking about as we look towards the future?
Um, yeah, I think um, sort of I think easy to use UX or user experiences
Mm.
are important. Kind of taking making it as easy as possible for people to get started. Don't overwhelm them with a lot of options right from the start. I think that's important. And create that, for us at least, it's this sort of create this kind of trusted environment, relaxed environment, essentially.
Mm.
Um, because for a lot of people, let's be honest, when we talk about telehealth, it might be a stressful experience, not just having to talk to their doctor via the computer, but also just talking to their doctor might, for a lot of people, be very stressful, right?
Yeah.
And so it's important then that you create an environment there that's suitable. So I
Okay.
think that is sort of very much, yeah, what is a focus point, and sort of that you guide them as smoothly as possible from, let's say, setting up the appointment all the way to kind of throughout the meeting and after the meeting, follow up, etc. That whole experience is very smooth.
Okay.
Um, Lots of
Right.
rough edges to be filed off there
Yeah.
that we
Okay.
discover as we go. So yeah,
Yeah. So what I think we should do is move to some kind of examples and kind of
yeah,
where these things can happen. What I will say is anyone who's, for all of you watching, we will be having a Q&A session at the end. So if you have any questions, please drop them in the kind of Q&A in Zoom. The kind of team are there to kind of help with that. We had a couple of questions, I think, as part of the original sign up as well. So we'll be getting to those. But let me switch to sharing my screen, because we didn't at the start, because you didn't want to be just seeing us talk to slides. And we thought actually a conversation might be better. But I think now it's time to, you know what we look like. It's time to share. If I can just operate that and do that, and I think we're in good shape. So I think, yeah, virtual visits and emotional dynamics. Andreas.
yeah. I will talk a little bit about this. So, what you want to do, and what we focus on, and this is very much in our pre-built UI. I will say so. We also offer an option to create your own UI, if that's of interest. But then you also want to take this into account, and we've done this with a lot of trial and error and kind of filing off the rough edges over time. And so, what's important here is that you design for emotional resonance. As I said, people who have a telehealth visit, a virtual telehealth visit, are often in a state where where it's perhaps hard to talk to their doctor. They might be stressed and so on. And so you want to make an environment that is as calming as possible for them. Things there, subtle things that make this happen is if you look, for instance, this is a screenshot of our pre-built UI. Having this green soft background doesn't make it look very corporate, makes it kind of friendly. Little details like rounded corners, you don't see them so well perhaps on this slide. With all the UI, the buttons and the video tiles and so on have these soft rounded corners, makes it also less corporate, less sharp, less blocky. And that helps. And also making the UI, easy to understand, of course, easy to understand buttons, no mystery navigation, but you know actually what will happen when you click or hover over certain buttons. And that is very important so that users find, okay, I know what all of these things do, and I also know my way out if I want to leave the session. So those are some things to keep in mind essentially when designing an experience, and that's what we try to do.
Right. Okay.
Mm-hmm.
You ready for the next one?
Yep, let's
Great.
do it.
There you go. Right.
And so here, this is, I already talked a little bit about sort of the non-corporate aspect of what we try to do. You don't want to offer people a grid layout or a clear side-by-side, split screen type of experience that you might know from other video conferencing providers that you use in a corporate setting. Those video providers or those video users have their uses, or video setups have their uses, but they might not be suitable for telehealth situations, for instance. And so some subtle things we've been implementing are these kind of very flexible layouts. You can actually, if you want to kind of magnify or rearrange the tiles yourself, which might be maybe not so useful. I mean, you're just with two in a session, but maybe in a small group session, for instance, you might want to rearrange your layout. Another thing, for instance, this came directly from one of our customers, is they said, well, when we have a session with our patient, we don't want them to look at themselves all the time and make sure that they look well and just focus on. We want them to focus on the therapist instead. And so we had already this setup where we have a large view and self view is small in the bottom right corner. But I said, just show it briefly and then hide it to the side. And so we implemented that for them. And this allows the patient to kind of really focus on their therapist and really be engaged in the meeting. And then, of course, mobile. Mobile is important. As I said, 33% of sessions that we see have a user on mobile phone. And so making sure that your UI works there in all screen orientations and sizes is important. So it's very relevant to test on a range of mobile devices, because people might switch between devices even mid-session. Sometimes we see that they go from desktop to mobile and vice versa. So this experience needs to be, you need to have a continuous experience essentially. And if you have certain features that, say, for instance, are only available on hover, when you hover over a button, you need to make sure that those are also available on mobile. So then, for instance, a long tap and you get submenus and so on that appear. So there's quite a lot of things to keep in mind there.
Okay. Thank you. Yes, that kind of idea around, we're so used to kind of looking at ourselves or using these tools in a particular way. It's a completely different context.
Exactly.
Yeah. Okay. Tech fatigue. Talk to us a bit about that in this situation, in this scenario.
Yes. So, and this is sort of something we experience in particularly in the context of real-time audio and video. Not always everything goes well, right? Your camera might not work, you might have a microphone problem, perhaps you're on the go and you have poor connectivity. And so in order to kind of reduce the chances of something going wrong, and then people blaming themselves and sort of saying, oh, it's probably my fault, or I'm really, basically they get tired of having to deal with all kinds of things. We try to make this as easy as possible for them. So we have an option that we've added to have a kind of an extensive pre-call check that the user can go to. The standard one is very simple, but there's an extensive one where we check does their camera work, does their speaker work, and the microphone, they say something and they hear their own voice. And then we also do a connectivity test. If the connectivity test is sort of so-so, then we offer them an option to kind of join the call in a low bandwidth mode. And then also during the call, we give them an option to investigate meeting diagnostics. If they see, oh, I've got an indicator on my screen that shows I've got poor connectivity, what exactly is going on? And sometimes that might be something like not that your bandwidth or your internet is bad, but that you have too many tabs and apps open in the background because CPU, basically how hard your computer works, is also something that can have a negative impact on audio and video, as we learned. And so it often helps a lot to kind of turn off some background processes, and suddenly your quality improves. So those kind of things we try to guide users before and during the call, sort of that they can take action themselves and feel empowered essentially in improving or improving their situation or making sure that they're well set up to have a good experience with their therapist.
Yeah, I guess in the telehealth situation, you've kind of got a real diversity
Yeah,
of tech capabilities.
exactly.
So allowing people to kind of go to the level
Yeah.
that they want to. Yeah, like you say, enables and gives them agency over their experience.
Yeah. And what we see, for instance, it's sometimes they will join on older laptops, right? Sometimes these laptops have old browsers on them, so it's important that we do this check. And then something we see, for instance, sometimes on Windows, camera drivers are outdated and cause some problems. And I think on iOS, for instance, sometimes we see that people struggle with their OS permissions, and then we help them kind of fix those permissions so that they give access to their camera and microphone in order to join the call. So it's sometimes very platform specific and
Okay.
quite challenging things to
Yeah.
to help them get around. Yeah.
Okay, great. And then we're on to, so this is something I want to talk about because I think when it comes to scheduling, so what we've been talking about so far, I think, is the kind of in session or the kind of the actual session, kind of either side of the session. But there's also the scheduling of the session. These things there's an interaction happening between two people that needs scheduling in. And a lot of the kind of assumptions we see in scheduling implementation is, people take that Calendly UI that we're all aware of, that sort of date time picker with kind of months and days, and we're back to this kind of corporate context. We're used to using that in a corporate context. But what I liked about this is an example from the UK NHS application. So this is looking at my doctors, and there aren't that many appointments. And actually, they've not tried to kind of put that through a sort of complex UI. It's like literally there are 4 appointments. You can choose them, and made it very, very clear to me what can be chosen very, very quickly. And so, especially on mobile, it made the whole experience far more actionable. Right, okay, I've got like 2 Wednesdays and a Thursday over the next couple of weeks to choose from. I'll go ahead and do that. And I think there's something in there around, especially in telehealth, where perhaps there are constraints over appointment availability. Think about how you can kind of present the information in perhaps a different way to make it far easier for the person to comprehend what they're selecting and the decision that they're making. And then I think the other thing for me, I wanted to kind of chime in on is around the kind of pre and post consultation. And we talked about this idea around getting people prepared and the kind of onboarding that Andreas was talking about when they kind of go into the session. There's the kind of waiting room concept, but there's almost the kind of the bits before and after, the kind of pre and post consultation. And we're getting kind of in the weeds of implementation. But if you want to send someone a reminder about an appointment, that's a kind of easy thing to do technically, as long as the meeting doesn't get rescheduled. Because you can put a job to be done at a certain time to send a certain email, but the moment anything changes, you have a problem. So part of what Cronofy does with our scheduling infrastructure is we allow software vendors to attach webhooks at times relative to the start or end of the event. So what that means is no matter when the event in the calendar actually happens, where it ends up getting moved to, even if it gets moved by the clinician in their calendar and the patient accepts it, 10 minutes before, an hour before, 24 hours before, Cronofy will notify your application. So then you can trigger any workflows, pre-meets, emails out, text message reminders, anything as part of that process. And likewise, post as well. And for me, this is one of these areas where what I enjoy about the kind of Cronofy and Whereby partnership is that we are really here to solve that plumbing piece. And there's so much work engineering teams do that's kind of is repeated in so many applications because that they haven't got access to that plumbing. So what we're doing is making sure that that plumbing is available to you. So with the combination of our two applications, two services, again, if the meeting gets rescheduled by the clinician in their calendar, we'll update Whereby as well. So that meeting gets scheduled, it gets moved to the right point and everyone can join and everything still works. So, and then if we go to accessibility, this is a really important point, especially in the kind of the scheduling flows that we talked about. For us, is the ability to navigate by keyboard, because whilst a lot of the consultations necessarily happen on mobile, there's so much so much of an assumption around using a mouse to do things, and then any scheduling flow needs to be completely navigable by keyboard or by screen readers, etc. But yeah, certainly you imagine you've got more on that, Andreas.
Yeah, for sure. Yeah, it's important here to see accessibility not just as a matter of compliance, but actually a core differentiator, I would say. And so it's really possible, and there's a true opportunity here to kind of build an experience that stands out from an accessibility viewpoint, or from an accessibility perspective, and make that a core differentiator essentially of your product. Um, we've been we did quite a bit of investment in this last year. And as you say, making everything keyboard accessible is important, not just, reachable by mouse. And sometimes you have to really think there on how we do this, how should we do this the best way. So there's sometimes challenges to be, overcome really. Um, another another particular thing there that stands out also, and sometimes it's counterintuitive. I remember we had keyboard shortcuts as part of our product, but actually we had to add a toggle in order to be compliant to allow users to turn off those keyboard shortcuts because they might interfere with their own keyboard shortcuts they had configured if they use accessibility software. So it's not always obvious, and it's not enough to sort of say, okay, I can reach all the buttons with the tab key. Sometimes you really have to go out of your way to kind of imagine yourselves in the shoes of the person trying to use screen reader software and really create an accessible experience.
Yeah, every tech person loves their keyboard shortcuts, and I think
Yeah.
it's very easy for us in our little sort of tech bubble to think, oh, we're being hyper efficient, we're making everyone be hyper efficient. But like you say, if A, people don't use them, or B, more importantly, they have their own because of their own needs, that's definitely something that needs to be thought about.
Yeah, and then we've also been looking now at, because you have, of course, AI has made great strides to provide closed captioning,
Mm.
which was sort of a bit of an exotic features a couple of years ago, and now it became almost table stakes, where people expect some sort of closed captioning or transcription type of feature to be there, just not just as an accessibility feature, but even you can imagine, this being useful for many people. Let's say you're not a native speaker, then having something that transcribes or aids you essentially understanding what is being said is also important, right? So there's lots of use cases for it.
Oh, I think, thinking of times when I've been to the doctor and you think, right, what did they say?
What
Having
did they
that
say
transcript.
exactly?
Yeah.
Exactly.
What
Yeah,
was I
yeah.
supposed to do again?
Yeah,
Like,
yeah, yeah. And you walk out and you're like, I know a lot of things were said, but I don't quite know. This definitely helps. And yeah, you can actually also be more in the moment and not waste your time with taking notes, right? And divert your attention, but instead be completely focused. So yeah, there's lots of use cases for it and additional uses beyond accessibility. So I think in general, having this mindset that accessibility is more than just a checkbox requirement is important to build great UI, great experiences. Also, accessibility is never done. It's never something you say, we do once and now we are accessible. You will see that, if you have that, then immediately you will be not accessible anymore a couple of weeks later. It's really also an engineering mindset that needs to change and that needs to have that embedded. So whenever they build new features, every new feature that needs to be built with accessibility in mind.
Yeah, that's absolutely something we are driving on our side as well. So, yeah, we talked about privacy and trust building. Certainly from our side, because we deal with calendars and calendar data, and the wonderful and terrible thing about calendars is they're this kind of sea of uncategorized, often quite personal, quite commercial information, especially when you get into healthcare appointments, and there's no real control over that. So this is where kind of we operate a managed service that kind of masks that data from the software vendor, so they just don't have to deal with it. Plus, we've invested super heavily in security and compliance, privacy accreditations. So yes, we're HIPAA compliant in the US, obviously SOC 2. We've got 3 different ISO standards that we apply to our infrastructure, both your standard 27001, but also 18 and 701, which covers kind of protecting and processing personal data. And so part of this is making sure, both in terms of the clinician side, that the data is in good hands, but also, I'm sure with what you're talking about on the patient side and how you build that side.
Sorry, what was your last? I just missed.
On your side, I think what we're talking about here is kind of on the patient side. So for us, it's very much focused on the clinician side and making sure that data is protected. I think for Whereby, is it more of a kind of a patient side of things?
It's probably to a certain extent, definitely on the UX side, yes, to kind of give this trust to the patient that they're in a private setting, in a trusted environment, and that we take their privacy seriously. But also, of course, on the platform side, we also provide certain settings they can configure in order for the meeting or the meeting to be HIPAA compliant, the integration to be HIPAA compliant, which is a regulation that matters for particularly in the US, and then of course GDPR compliance and so on as well. So yeah, all of those things are important as well and relevant in Europe, right? So this is something to keep in mind whenever you build a platform. Obviously, different regions have different regulations, and will require have different requirements essentially. So it's important to keep that in mind if you build a platform that's being used across different countries and definitely continents. That different local privacy regulations and requirements will come into play.
But I think, if I'm honest, I think both Cronofy and Whereby have an unfair advantage in this because we're both European companies.
Yes, indeed.
And so this is part of our DNA. This is how we operate. We've never had to kind of retrofit any of this onto our businesses.
Yeah, very much. So that's really, how we've built it up. And it's been relatively easy, I would say, to kind of be compliant. I know, for instance, there was we have also an option, for instance, to turn off display names, sort of that this information is not stored, which was something we had to do for being HIPAA compliant. But a lot of the building blocks were already there, so it was mostly a matter of, okay, if we configure it like this, we can be compliant, and yeah, it's very much because this is the service was built with privacy in its DNA, so that can bring us far.
So yeah, I do think European companies have a distinct advantage in this regard. When I look at how American companies naturally are they haven't had to deal with the regulation that we've had to deal with.
Exactly, and it will become more and more important. So I can only imagine, this is not going to go away.
No, not at all. People are going to become more aware of actually where their data is. Right. Okay. So, I guess what we're saying, we've described a lot of wonderful things that, and things to think about when you're building applications. Of course, we're here to say that you want to use both Cronofy and Whereby because we solve all sorts of problems for you. But I think, what were your kind of 3 things you would say to someone who's evaluating a vendor, just what kind of any of their their telehealth application?
I would say basically, first of all, perhaps pick your battles, right?
Mm.
Do the things you're good at and build the things you want to build. We say don't, or consider using a third-party provider, preferably whereby. If you have to deal with audio and video, real-time audio and video is hard. It's sort of like payments. When you do payments, you also integrate typically a third-party solution because credit cards, etc. is very complicated, similar with audio and video. So pick your battles. Another thing is, I would say, if you build something, definitely if you build a completely custom UI, it's important to think of these sort of imagine yourselves in the shoes of the people using it, particularly in our case, the patients and practitioners who will be using the software. Make sure that you kind of cater to sort of the emotional state they're in, make it as easy as possible to use the software. Don't overwhelm them with choice. And then a third one, perhaps, is, or don't overwhelm them with choice, as in don't give them too many buttons and too many things to pick between, right? Make it clear and straightforward, so that they can get done what they want to do. And then a third one is consider mobile. I think that is an important consideration whenever you pick a solution. Make sure that it works on mobile. If it's a pre-built solution, of course, you won't want to test it. And if you build something of your own, you need to make sure that you test across a wide range of devices and consider both desktop and mobile, because each come with their own, UX trade-offs. And sometimes that's hard to navigate, but it's very important to consider.
Okay, great. Yeah, no, I think this is the thing for me. Where you see teams successful is when, like I say, they've picked their battles. They recognize that there are things they need to do in order to differentiate, and there are things that just need doing. And payments is a great example of that. I'd argue. I always say that with Cronofy, our biggest competitor is developer optimism. It's calendars. How hard can it be? And I wouldn't be surprised if you've have kind of similar. Yeah, well, I can go to Amazon and get something or other to do this. Why do I need you? And I think it's only when the application gets into production and then you start to see the challenges and the edges really hit you, and suddenly you're maintaining and fixing rather than developing your application. And I think that's the value of kind of building together a sort of a cadre of key partners gives you. So we're going to have a bit of a short message from our sponsors section. So before we get into the Q&A, so that's the this is some work we've been doing with Docplanner, and we're basically essentially allowing them to provide the seamless scheduling experience using our white label APIs. So Albert very kindly provided this. Do you want to talk to your work with on the
Nilo, yeah, Nilo. They're formerly known as Nilo Health, but have recently rebranded to Nilo. And so Nilo has been very happy with Whereby. They've seen a 60% drop in technical issue support tickets since switching to Whereby. They've had amazingly high customer ratings, 4.96, which is very good out of 5. And they've also seen a drop in video sessions impacted by technical issues from 5% to less than 1%. So we're very happy to see that. And yeah,
that's fantastic. That's a proper case study, that is, and a quote as well. So I'll just
exactly. So I'll let the quote speak for itself. But so yeah, they were really quick to integrate, and we're really happy with the speed. The speed essentially they got from integrating Whereby.
Okay, fantastic. And then a little about us. So you can sign up for a free developer account. We don't put anything in the way. You can get a developer account. You can try it all. You can even try the Whereby integration without giving us any money at all. No credit card, no nothing. The support team are there to help. We truly believe, as I said, I'm a developer personally. I've been building and commercializing APIs since 2002, since way before they were cool. And learned very early on that what you need to do is empower developers to really properly test your platform to make sure they're comfortable. And these are some of the people that we're working with in the in the healthcare sector. And I'll let you talk about Whereby, Andreas.
Yeah. So Whereby, we have our Whereby embedded product. There's also a free account there that you can create. Don't need to give credit card details. You can try it out, play around with it, and build an integration essentially. And whenever you're ready to pay, there's a pay-as-you-go plan that you can sort of use to scale up and try it out with a wider audience. And as you can see, we have a lot of happy customers. We've listed a couple there. Wellnut, Ensemble, Vitud, DrDoctor, Adricare, and Accurx are some of the names that have signed with us.
Fantastic. Right. I think that's enough talking, well, for us telling you what we want to tell you. What do you want us to answer? What questions have we got? I'm hoping my team are going to share some of them very quickly, or drop something in the chat if you like. That's the other option. Okay, so got a question here. What questions do you ask yourself when you're trying to guide a user towards an outcome through UX/UI?
You want to go for that first, Adam?
Okay, so I think one of the techniques I've seen work is to try and get kind of emotionally invested in the experience. You want to actually kind of feel their pain. So rather than it being a kind of cold academic exercise where you're trying to do something in the kind of second person, actually become that person and try and kind of, especially I think with healthcare, it is really important. Try and feel what they're going to feel their pain, especially if you're evaluating an existing UX. That kind of blank mind problem is almost, this is like channeling your amateur dramatics, your kind of acting. You are a patient with these problems. What's going to happen? It's one of these things you just have to practice and get easy with. But that's how I'd approach that, certainly.
Yeah, I think it's important to get in the user's mindset, essentially, right? I can try to think about it, say if they join a Whereby or a telehealth call, right? Be it Whereby or another type of platform. What you want to do is really, reduce friction, guide them intuitively to what they need to do, and ensure that every step is really clear before, during, and after the consultation. So I think those are some of the things, and of course also accessibility, as we mentioned earlier.
Yeah.
That's those are to keep in mind.
Right. Next question. How do you balance a fantastic patient experience versus providing the safest experience for eligible patients? So is there a compromise here between ease of use and security? I think that's the thrust of the question.
Yeah. I think there the art is really to see this as a feature, because not something as a hurdle to overcome, but really as an opportunity to explain and also create this trust with the patient, because you need that as well, right? And so, for instance, just to give an example, we need access to the camera and the microphone in order to start the conference. This is a security feature that's present in browsers. We need to tell the user about this. But so it's a good moment then to kind of educate them and sort of say, hey, we need this for this particular reason. And you have to accept the permission, right? And if they don't do it, we guide them and to explain them, okay, why or how they can enable it. And then perhaps even if they don't want to show their face, we still need to be able to they don't want to turn on their camera effectively, right? We still want them to be able to join the call. So we want to enable them to say, okay, you can have a microphone only session, right? So kind of, I think it's an opportunity there they don't have to be, going against each other essentially. And so you can use this as a moment to educate and kind of create this trust that is needed in the experience.
Yeah, I think you're absolutely right. The trust piece is key, and I like what you're saying there is like, what if someone doesn't trust the video or doesn't want the video? There's all sorts of reasons why they may not want to have the video on.
Yeah,
Make it available to them to do that.
exactly. Exactly.
I think also I wonder whether this is a bit, there's this kind of mantra we have as if you kind of outside, if you take us outside of telehealth, but there's a mantra in like product in SaaS, which is like streamline the onboarding flow, get people through the process as quickly as possible. And I'm not a huge fan of that because I think there's real value in helping people understand, go through a process and qualify them and make sure that you've learned information about them in the process. So I don't think fantastic necessarily, and maybe I'm just reading into this, maybe I'm guilty of just reading into that question actually. Fantastic doesn't mean quick. It
No,
means I can get what I need out of this, which is actually a consultation, a valuable consultation with my physician.
exactly. Yeah, you have similar trade-offs with notifications, probably, right, in browsers as well. You want to be able to send them, but not too much, and you want to kind of balance this, and it's better to do this, in the right way than in the quickest way, or in sort of a way that is not thought through. So yeah.
Okay. I got another one here. So what are some effective ways to remove cognitive load in a video consultation?
Um,
It's
yeah,
definitely a you question, Andreas.
yeah, that's fast. For me. So ways to reduce a cognitive load are uh, so I would say allow users to say, for instance, hide the UI, parts of the UI when they want to.
Mm,
Sometimes these, software can be overwhelming. They just want to focus on the core experience of talking to their therapist, for instance.
mm,
So offering ways for them to hide buttons and bells and whistles essentially is good practice. We offer this as well in our pre-built UI, but that's something to keep in mind. Another thing are sometimes non-obvious features. For instance, we implemented a way for users to blur their background, but then
mm,
we also had some platforms asking, okay, can we apply this by default when a user joins? Because like that, the focus is more on, the person rather than whatever is happening in the background.
mm.
And so by default, when they join the meeting room, their background will be obfuscated.
Right.
Things like that are subtle things that you can also use to kind of create a more engaging and kind of directly connected experience. So those are just some things in which you can do that.
Okay. So again, I think this is definitely one for you, but what would you say is the biggest quick win to improve UX for patients? What's your go-to thing that you see your clients do that you think, actually, you know what, you should do this?
That's a good question. Let me have a think about that. I It's hard to give a kind of one answer that covers all of it. But sort of going back, I think, to what we said earlier, like really putting yourself in the patient's or in the user's shoes, so to
Mm,
say, the end user's shoes, trying to think about the whole journey before, during, and after, and trying to reduce clutter and unnecessary, steps, perhaps. Think really about what needs to be surfaced, and readily accessible or available versus what can we move to the settings so that it's not overwhelming, and really doing that design exercise over and over again. And sometimes, of course, companies are happy to release new features and sort of bring them to the foreground and look what
mm,
we've done. But you need to make, to kind of get users to use them, but you need to make, do the exercise to think like, is this really necessary? Or should this be, something that's available on demand only, or more in the background, or perhaps is triggered automatically given certain circumstances. Those are sort of the things I would look at. And I
okay.
think we all know we have a lot of interfaces in our lives that can definitely use some decluttering. So unleashing my inner Maria Kondo, I think, yeah, would be the way I would approach it. Yeah.
Right. Yeah, we've got another question about kind of first-time users, but it sounds, I think the answer is probably the same. It's almost like treat everyone like a first-time user.
Yeah.
As we said earlier, this idea of being able to progressively make it more complicated yourself based on your own capabilities is probably a good way to go, rather than load it all up front and allow people to start to remove things.
And yeah, good defaults matter essentially, right?
Yeah.
That is important. You want to give users some flexibility to reconfigure things, but
Mm,
don't overwhelm them immediately with offering that choice. Make it optional
mm.
and make a good default experience, as I think. And then as they're in the room, for instance, in our case, they will find ways to kind of modify it and make it more their own and configure it to their liking. Yeah.
Yeah, we do a similar thing with our scheduling plane, where we kind of basically, you can spin up the entire service
Yep.
with a bunch of defaults, like your working hours, 9 to 5, Monday to Friday, in your time zone. So, and like Google Meet as your default conferencing, all those kind of things, just to get someone to the point where they can use the tool, and then they can start to explore, okay, how do I want to customize this to my own needs?
And it's super, super important, right? The defaults matter so much.
Yes.
Uh,
Yeah. I think that's a really good point. Yeah. Defaults is super important. Okay. Two more. So we've got, what are some features in Cronofy/Whereby that help to improve UX? So I think for me, Cronofy as a standalone thing, for us, it's probably that real-time sync for us, in this idea that, when someone looks at the scheduling link powered by Cronofy, or scheduling kind of operation powered by Cronofy, whether that's through Cronofy UI or whether or not that's the application UI, they're seeing a real-time view of actually what's in that calendar. So there isn't that kind of double booking problem. And it's very easy for them to be, they can be confident, press the button to choose, and that time will be chosen. And likewise, all the kind of tracking we do around rescheduling or moving, even if that happens in the calendar, because the way we think about these things is we treat the calendar as a first-class experience. So when an event gets created, it gets created in your calendar. You're the owner of that event. If someone contacts you directly about that and you want to reschedule it, you shouldn't have to go back to the SaaS platform or the platform you used in order to change that. You should just change it in the calendar. And we provide all the tooling that notifies that back, but also in the case of the Whereby integration, then changes everything that needs to happen on Whereby as well. So all of that plumbing is done. So they're my Cronify UX features. What about your Whereby features that can improve UX?
yeah, I think for us, and I've talked a lot about the room experience and so on, but maybe taking a step back, the fact that whereby a room experience can be integrated, can be embedded as a web component or through an iframe inside a page or an application or platform, that's perhaps a very big UX aspect that is sort of worth mentioning, because when we think of video conference, we often think like, I'll take a video call and I'll go to a different app or a different place essentially. And
Mm.
so having this just integrated within the platform where you are talking, for instance, to your health provider, or um, we also are used in e-learning context, etc. So it might be, for instance, an e-learning app where you connect to your teacher and so on. Having that experience embedded and directly connected into the context where you're doing other stuff, where you log into your, let's say, trusted healthcare application, and right there you're talking to your therapist, for instance.
Mm.
Having that as is also sort of a part of the user experience. Helps create trust, obviously, as well, because you really know it's my doctor I'm talking to. I'm not you know going somewhere else and talking to somebody that I don't quite know. So having this connected is quite important, and I think that is something perhaps worth highlighting. That's a little bit more meta, perhaps, than the room
Mm.
experience and how it all works, but it's an important thing and kind of a differentiator, I might
Right.
say,
Yeah.
compared to the solutions. Yeah, and I'm sure Cronify as well can be, of course, integrated, right? That's the whole point.
Yeah. Yeah. Yeah, absolutely. Yes, it really depends on the needs of our platform and the needs and the scheduling needs, if you like. And we've got a follow-up question around where should you focus in your UI UX to make rescheduling appointments easier, smoother. Where we say is you should, if you want to support rescheduling, then provide a deep link to the point where someone can reschedule, especially in the calendar invite that you put in their calendar. Even if we have a technology, you can either invite people directly from people's calendars, or you can send them a separate invite, which again works quite well in the telehealth sector, where you want to provide the candidate, the patient, with a sort of set of information that's specific to their needs. Include the rescheduling link in the calendar link, because that's where they'll go to start with. It should also be in an email. It should also be in the portal. Now, if that rescheduling link is to a Cronofy link, or that rescheduling link is to your own UI that you're using to run that, just make sure you can go straight there, I think, and then very quickly see the options. Because I think, like say, doing that in line as an option, that sort of trust, I'm still in the same place, I'm still doing the same thing, make the choosing operation very similar to the initial choice operation as well. So they're seeing the same, essentially they're seeing the same thing. They're going through the same flow. They've got that kind of reassurance. Oh, this will work again. I know how this is going to work out. But also take advantage of the way we track updating events is that if you update the event, we'll move all of the relevant events in the calendar rather than delete them and create new ones. Because deleting and creating new ones creates a dissonance for people, and they're kind of, hold on, I've lost an event, there's a new one, and maybe the calendar event doesn't get added straight away. There's that kind of jeopardy moment where people think they've broken something. Whereas what you want to do is lean into the way calendars work, which is these things are updated. So you update it and then let the calendar app do its thing. And as far as the patient's concerned, it's just normal.
Right. That makes sense.
Right. I think we've done 57 minutes, Andreas. I think our audience have had enough of us. They've had their pound of flesh.
Might very well be the case.
Okay, well, it's been an absolute joy.
Yeah.
Thank you for taking the time.
Thank you for having me. It was
so likewise, if anyone wants to know any more, we'll be following up with a recording of this to everyone who signed up. But Cronofy.com, whereby.com.
Yep.
Let's help you. Okay, thanks all. Bye.
Thank you. Thanks very much. Bye-bye.